amount that they pay us is inadequate to pay our expenses for those things. So just think about that. These are government-run healthcare plans. That's really an important thing for you to understand. And I don't think it's going to get any better. One of the understand that this no option is not. This option is not an option. In the current bill, in Section 202, it says after 2013, and there's some specific dates. It said there will be no private health insurance that can be sold. So there is no option here. This is a government mandate. They're taking over the system.
Did he lie?
Oh,
Yes. Yes.
Joe Wilson was right.
Joe Wilson was right.
The reason why they're having so much trouble paying hospitals and doctors in Medicare and Medicaid is because there's so much fraud. Now, if you were running a business, and this is what they say, our fraud and inappropriate payments is somewhere between 5 to 20%. Now, let me put that in numbers for you. In Florida, Medicaid, there are 3 million people in Medicaid. The budget is $16.2 billion. 5% of that is $800 million. 20% of that is $3.2 billion. That is money that we are paying as taxpayers into this system that's not going to pay for health care for our citizens. What's wrong with that? Who's administering it?
Government.
The government. They don't have any business being in this business.
That's right.
Lastly, I think it's really important to understand, somebody's got a sign here about tort reform. This is very simple. It's already been done. In 1977, when Florida was in a crisis about health care, and California was in a crisis about health care, medical insurance for doctors, California did a simple thing. They said, we're going to put a cap on pain and suffering at $250,000. Florida did not do that. Now, it's 2009. In Tallahassee, if you're an obstetrician, you're paying about $260,000 a year for liability insurance. Just think about that. It's about $1,000 a working day. If I move from Tallahassee to Los Angeles is anything cheaper than in Los Angeles? Liability insurance for doctors is. An obstetrician there pays about $51,000 for the same coverage. What's the difference? One thing only.
Tort reform.
One thing. No, it's not
Medical
a
malpractice.
cap on pain and
it's
suffering. Nobody's going to deny somebody what it costs them. The pain and suffering thing is where the lawyers are making a whole lot of money.
That's right.
That's what's driven.
That's right. That's where the suffering is.
Up so high. So that experiment's already been done. There's no guesswork on this. If this state legislature put a cap, which they've fought against since 1977, we'd have the same kind of
Because they're all lawyers.
Costs would go down for physicians, so that I can pay my light bills and still accept the lower payments that come from these other places. So I think those are things that y'all need to know so when you talk to your friends about these issues. Those are the facts. Well, it doesn't have to be. Well, we have a group that's their agenda. So I think those are things that are important. This is not an option. This is a mandate. There's a lot of fraud in the system. It can be taken care of. There's ways to do it. And tort reform has already been successful in California. It can be here in Florida as well.